This is an audit on stillbirths at Medway Maritime Hospital in 2008. The audit was performed retrospectively in 2009. Background: CMA-CE showed the higher the national average rate of stillbirths at Medway Maritime Hospital for 2008. There were 34 stillbirths with info missing for 2, and defined stillbirth as a baby delivered with no signs of life after 24 completed weeks of pregnancy, and excluded terminations for fetal abnormalities. At Medway there were 6.3 per 1,000 compared to 3.9 per 1,000 nationally, and this has increased from 5.1 in 2007, and there were a total of 4,737 live births in 2008. Causes: several factors have been found to increase the risk: maternal, age, smoking, a high or very low BMI, hypertension, diabetes, and SLE, and probably other related conditions. Fetal malformation, intrauterine growth restriction, and other infection or placental dysfunction. Aim: identify any modifiable causes of stillbirth. Method: retrospective audit of stillbirths in 2008. List of patients from stillbirth register on the delivery suite, and review of case notes and completion of a proforma. The information that was included in the proforma: age of the mother, parity, previous C-section, previous stillbirth, smoking, BMI, medical history, first trimester screening, anomaly scan, PET and PIH, IUGR, gestation, autopsy, placental histology, and the torch and thrombophilia screens. Results: 34 stillbirths in total. Data from 2 patients was not available and was also not included in the CMAC. 2 patients were transferred into the trust shortly prior to the delivery. 1 patient booked at 24 weeks and had no scans or other assessments previously, and 1 pregnancy was concealed until delivery at home. 10 of the women were primips, 22 were multips, 4 twins, and caesarean section. A study published in Lancet in 2003 showed an increase in the incidence of stillbirths in women with a previous caesarean section. In this study, 8 of the 32 patients had a previous C-section. I haven't gone into why the risk was increased. So, age studies show an increase in stillbirth rate in those less than 20 and those more than 35. In this audit, 5 patients were below 20 and 3 above 35. Maternal health: diabetes increases risk by 7-fold, and so on. SLE, smoking: 6 were current smokers, 3x and 23 had never smoked. BMI, meta-analysis studies looking at obesity estimate that obese women in particular had double the risk of stillbirth compared to normal weight, and obesity increases the risk of associated things like hypertension, diabetes, which are also established factors for stillbirths. This may not be an independent predictor in itself. 25% of women in this year, or in 2008, at Medway had a BMI greater than 30 of the stillbirths. So here we just broke it down. If the BMI was less than 20, there was 1 woman with a stillbirth, but I need to qualify it, that this is from all the stillbirths. So perhaps this could be clearer if it was presented somewhat differently. Hypertension and preeclampsia affect placental perfusion, increasing the risk of stillbirth. In this audit of patients who had stillbirths, 1 patient had essential hypertension treated with methyl dopa, and 3 had pregnancy-induced hypertension, 1 of whom had intrauterine growth restriction, and 2 went on to develop PET. 3 out of 4 had placental abruptions. IUGR, strong association between that and stillbirths. In 2008, IUGR was present in 10 of the 32 cases, only 5 of which were diagnosed on ultrasound prior to the delivery. Okay, and this is that in a graph. Gestation and birth weight, small birth weight, normal birth weight. And in terms of the post-mortem, 19 of the 32 had no autopsy, and the placental histology, 2 cases of abruption, 2 retroplacental hemorrhage, 2 thrombosis, 1 vascular congestion, 1 increased neutrophils and microcalcification, inflammation, cord accident, chorioamnionitis. 5 were entirely normal, and 2 of the results were not found. Having established the significance of this in relation to the stillbirth, and in particular what would have happened first and what was the consequence. Post-mortem, normal 4, with an abnormal placenta histology, external only or large for gestational age, placenta, morphological changes in diabetes, IUGR, acute hypoxic insult, cardiac failure, fetal demise 2 weeks prior to delivery, dysmorphic facial features, redundant nuchal folds, talipes, fetal thrombotic vasculopathy, IUGR. So again, all sort of small numbers that underwent the post-mortem essentially. Causes of stillbirth, unexplained in 9 cases, cord accidents in 5 with 1 true knot, IUGR alone in 5, IUGR plus abruption in 3, with fetal vasculopathy and superficial implantation of placenta in 2, placental abruption, chorioamnionitis, placental and cord thrombosis or congenital abnormality. Only 13 of the 32 had a post-mortem, and 8 out of 9 unexplained stillbirth had no post-mortem. In terms of further advised recommendations, everybody had a full blood count. Only a very small percentage, or a third, had the HbA1c checked. The majority had a thrombophilia screen. The majority, or everyone, had a blood group test. Only about 56% actually completed a torch screen, and the majority had a placental histology. So why did the stillbirths increase from 2007 to 2008? And this may not really be reliable, but pregnancy under the age of 18, Medway significantly worse than the national rate, so a known risk factor for increasing stillbirths. Smoking, again, Medway significantly worse than national rate. Obese adults, Medway worse than the national rate. People diagnosed with diabetes, Medway significantly worse than the national rate. So in many ways this explains why Medway should be expected to have a higher rate of stillbirths than the national rate. So recommendations: smoking cessation programs, weight loss. How can we achieve this? Well, physical activity. Medway fared significantly worse than the national rate for adults. And healthy eating, again, Medway fared significantly worse than the national rate. Teenage pregnancy support, more counseling regarding post-mortem, it may be helpful. And use the protocol for stillbirth to check the investigations are done, in particular HbA1c and the torch screen. Be vigilant. This is a high-risk population. And here are the references.